The views and opinions expressed by the host of Black Talk Radio News and any guest represents their views and their views only and do not necessarily represent the views of the Black Talk Media Project or the Black Talk Radio Network. Hello and welcome to this Black Talk Radio News commentary. My name is Scotty Reed. You know, I've been observing and actually part of a couple of COVID-19 conversations on social media, as well as the vaccines. And there's a lot of vaccine hesitancy, not just among the Black community, but that's the one I'm most concerned about. And not just the Black community here in the United States, but the Black community worldwide, whether you're on the African continent, whether you are in the African diaspora, wherever you are. I think it is showing that we have more African descendant people being adversely impacted by this virus than any other group of people on the planet. I know India, a month or two ago, they were reporting some very, very bad outbreaks. And don't get me wrong, I understand the skepticism, but the stakes are too high. We're talking millions of lives that have already been lost to this virus worldwide versus what? Less than 100 people worldwide who have gotten these vaccines and have had adverse reactions to them. Yes, some people have died. Some people have had very bad reactions to the various vaccines that's on the market, but there are far more people who are dying from the actual virus. And I have what I call, what did I call it before? I think I called it anti-vaccine and anti-masking, not hesitancy. What was it? Fatigue. Yes, I'm sorry, I got a brain fart there. But I have anti-vaccine and anti-masking fatigue. And I've actually had to just block some people on my social media who were just coming at me in a very negative way, not trying to have a constructive conversation where we're being respectful of each other. But I actually had somebody on Instagram threaten me. And what did they threaten me for? For sharing a graphic that wasn't even about COVID, but about how bacteria and viruses spread among humans. That what it was, this doctor put together graphic that showed cultures, which showed on one side it said without a mask, and it had this row that said, you know, from talking, this is how much bacteria got into the culture, from singing for 1 minute, from sneezing, from 2 coughs. And then on the other side, it had the cultures where a person had a mask on. And obviously, you know, the one with the mask, those cultures did not show any bacteria whatsoever being transmitted. I actually did a video here recently with my grandson where I was using a spray bottle. I put surgical masks, those little blue masks, 2 of them, one facing the upside, which would have been going out, the outward side, and then on the other one, the inside, and laid it down across some brown paper towels or napkins or what have you. And then, you know, we sprayed them to show that these masks do afford some protection, because we're, you know, people are looking for all kind of information to confirm the biases that they already have. It doesn't matter if it's scientific or not, if it confirms, or accurate or not. If it confirms a bias that they already hold, then they're going to run with, you know, whatever feeds into their biases, which confirms whatever viewpoints that they held before, you know, this situation came up, or about anything. It's called confirmation bias. Look it up. All right. So I think that this is, the stakes are too high to be allowing ourselves to not objectively do our research and look at the information, but for someone to threaten me and talking about they know where I am, it's no secret where I am. I'm a very public person. I run a very public nonprofit. I run a very public platform. So lots of people know who I am. All right. But for a Black person to basically threaten my life for sharing a graphic, I don't think I had to tell reasonable people how foul that is. And don't think I'm an easy target. Yeah, you may know where I live, but guess what? You will be coming to a place where I have hundreds of family members. Okay. So I'm not an easy target and I'm well capable of defending myself. But for someone to go to that extreme for me sharing that information, it's just crazy. So I've tried to share Black sources because, yes, Black people should be skeptical of the medical system, should be skeptical of the government based on its history. But when you have all of these Black health organizations, Black doctors, Black nurses, Black surgeons, Black scientists, some even took part in the development of the vaccine, that ought to tell you something. That ought to tell you something, that this is very serious. It's not a hoax. It's not being overhyped. And they're not trying to kill anyone with the vaccine. Do people die from the vaccine? Again, less than 100 people. Less than 100 people, and somebody will take one case of someone having an adverse reaction and act like that's the outcome for the hundreds of millions of people who have been vaccinated. Come on now. Is that logical? Is that a logical way to think? Certainly, it is not to logically thinking people, rational people. But again, people are just looking for information to confirm their biases. And then we have religious figures, ministers, who have no background in science, no background in medicine, but telling us that God told them to not take the vaccine. And I represent Christ. No, you don't. You're not even a Christian, so how can you represent Christ? But to use your quote unquote religious authority or your religious influence and to think that God told you something he ain't told the rest of us, like, you're the only one that can communicate with the creator, is just absurd. But for you to be running an active campaign, tell Black people not to get vaccinated, I think you might be working for the enemy. You might be working for the enemy. Because if we use logic, if the vaccine was to sterilize us, and oh, by the way, look up, do a search on COVID-19 may cause sterility as some of the casualties of this virus. There's a study, and it hasn't been completed, and it's still early on, but they're finding the virus teeming in people's testicles and penile tissue, which suggests that it could sterilize individuals. So you may recover, but what if you're sterile? And I mean, people are saying that about the vaccine is to sterilize us, but they offer no peer-reviewed studies, no clinical studies or anything like that, just putting stuff out there and throwing stuff against the wall and hoping it sticks in your mind. Again, the stakes are very high. The stakes are very high. And I'm very concerned. I'm very concerned about African descendant people in this world being affected by this virus. But again, if you're trying to depopulate the earth with a vaccine, would it make sense then that the wealthy people would be paying to jump ahead of the line to get the vaccine? Yes, there's been those reports. You had Governor of Florida, Ron DeSantis, be accused of setting up vaccine clinics for his wealthy constituents, jumping ahead of the line. Would they be withholding this vaccine from many of the quote unquote third world countries, but we'll call them non-white, the non-white countries? There are some countries in South America that haven't had no access to the vaccine, and the pharmaceutical companies are fighting. Although the World Health Organization is calling on them to waive intellectual property rights so that the vaccines can be mass produced in a country like India that has the labs and the infrastructure, because most of this stuff is made in India. Most of your medications and pharmaceuticals, a lot of them, I shouldn't say most, but a good percentage of them are made there because they have the labs, they have the infrastructure. out. And so they're not releasing the intellectual property rights because their motive, as we know in a system of capitalism that values profit over life, is their main motivation for even being in business is profit, not to save lives. So again, I ask people to use logic. Use logic. All right. So again, I get the hesitancy, but again, I have been sharing clips from blackdoctors.org. You can go look up their website. These are Black healthcare professionals, doctors, and what have you, who are giving you solid information. And for the conspiracy theorists, that will be a hell of a conspiracy if you could get all of these doctors, not just in the United States, but worldwide, doctors in India, doctors in China, doctors in Africa, all of these scientists, all of these different health organizations. That means that all of them have signed on to perpetrate this hoax and to help whoever you think is trying to depopulate the earth to push the vaccine, to sterilize people. I just don't believe that. That's highly unlikely that you would get so many news media outlets based all over the world to make up these false reports about the casualties and all of these people being hospitalized. You think they just making up these stories? So that should tell you something. And these people aren't being hospitalized, I should say, 90+% of these people being hospitalized are not those who have been vaccinated. There are some breakthrough cases, that is true. And it's being reported. And that's why they're talking about booster shots. But the vast majority of the reports of those occupying the ICU beds are the unvaccinated. We keep seeing story after story after story of these anti-masking people ending up in the ICU on their deathbeds. Okay, so I just don't believe that there's any kind of grand conspiracy to get millions of people, millions of healthcare professionals worldwide, millions of journalists worldwide to participate in this hoax. Just as it doesn't seem possible, nor is it likely, and it just doesn't seem logical. But, you know, again, people will reject information and simply latch on to that which confirms their biases. I remember, and y'all can look this up, I remember when COVID first broke out, white supremacists, white nationalists were saying, if you catch COVID, it is your duty to go into Black communities here in the United States and spread it by spitting on doors, wiping, you know, your fluids, their fluids on door handles and stuff like that. Look it up. You ain't got to believe me. Look it up unless you're going to say, oh, that's a hoax too. There was a conspiracy to depopulate, then it wouldn't be through the vaccine. It would be through the withholding of the vaccine, which again, I mentioned, most of the non-white countries don't have access to the vaccine. But again, look up African sources, the continent of Africa. That's why I had that graphic up, and I put the source of the graphic, and I'll pull up the page where I got it from, Wikimedia. So these are serious outbreaks in Africa. Are all these African sources lying? Are all these African governments lying? Yeah, you will latch on to what? The one president of Tanzania who had skepticism concerning the COVID test. I've seen memes going around about that. Guess what? That man is dead. They suspect from COVID. It's not his cause of death is not being released, but he was mocking it. Now he's dead. The president of Tanzania. Okay. But are you telling me that all of these nations in Africa are helping these white supremacists perpetrate this conspiracy to sterilize their citizens or to perpetrate a hoax? And, you know, this virus ain't nothing but the common cold or something like that, or no deadlier than the flu. So let me get to some of these sources. African sources. So made a couple of posts in btrcommunity.com, which is the social media platform, the anti-racism social media platform run by our nonprofit Black Talk Media Project. And I posted a couple of stories there as I was, going through my emails, and I subscribe to allafrica.com, and I get a email, from them highlighting some of, the recent headlines that they have published on their website. So those are the stories we're going to take a look at. But first, this is where I got this map from. Okay. This is where I got it. COVID-19 outbreak Africa map. You can see from the map key, the pink area is 0 to 999 confirmed cases. The next one in the key, 1,000 to 9,999 cases. The next one, 10,000 to 99,999 confirmed cases. The second to last one, 100,000 cases to, what is that? 100, no, that's 1 million to 999,999 cases, and then over 1 million, the very darkest area. I believe that's South Africa is one of the darker areas. Then you go to Northern Africa, you see more serious outbreaks there, a couple of here in Eastern Africa, and one country on the west coast of Africa is experiencing serious outbreaks. So that's where I got this map from. All right, so let's go to the stories. All right, so this headline, South Africa's potential new variant. And I shared that picture, and I also link, let me just open that up, open up the photo, because I posted the link to the photo or in the photo description. So we're gonna go to allafrica.com, which has a African descendant publisher. Again, are they participating in perpetrating a fraud with Western media? Is that what you're telling me? So the most highly mutated COVID-19 variant yet is now circulating in most of the country. Again, they are talking about South Africa. New research published this week suggests that South Africa, where more than 13% of adults are now fully vaccinated against COVID-19, look, only 13%, may be facing a new variant of the virus. The Department of Health has alerted the World Health Organization, which is monitoring the situation. The variant identified by researchers from the National Institute of Communicable Diseases and the KwaZulu-Natal Research, Innovation, and Sequencing Platform is being referred to as the C.1.2 lineage. The majority of this lineage sequences from around the world so far are from South Africa. So this appears to be something different than the Delta virus. It was first detected in Mpumalanga and Gauteng in May, near the beginning of the country's third wave of infections. A month later, it had showed up in KwaZulu-Natal and Limpopo, as well as in England and China. So it goes on, talk about it. This is different than the Delta. Delta will not be the last variant, it says. So are you telling me that these African research institutes are lying as well? See, a lot of people want to engage in spookisms. What are spookisms? Spookisms is a word that I don't think I made it up, but I'm using it as a term to where a person tries to instill fear into you by saying the white man trying to kill you, the white man trying to do this, the white man trying to do that. And yeah, the white man trying to do a lot of things. A lot of racist suspects out there harming Black people. But that isn't that isn't sufficient for me to just take your word that what you're pushing is true, using spookisms to instill fear into me instead of me relying on science, relying on scientific research, medical research, and the professionals, because I'm not a professional. All right, so let me go back to my page, pull up the next story out of Africa. Africa records over 394 COVID-19 deaths as cases rise. Well, some people say, well, earlier from the graphic, it was showing like over a million cases confirmed. That was cases confirmed, not deaths. And then there are some people that will be like, oh, these are acceptable casualties. Hey, as long as all of us ain't dying, right? Yeah, unless it's your family. Okay, and then there are COVID long haul symptoms, which can, again, they're saying that COVID could lead to sterility. It's not a fact, but there are signs, according to that study, saying that they're finding COVID teeming and thriving in the testicles and the penile tissue of COVID casualties, which would then suggest that COVID is the new STD as well. So let me go to the actual source that I linked to. I believe I linked to it. Let me go here. Again, All Africa, which has media partners all over Africa. Africans reporting on Africa. So this one is about Africa records over 193,394 COVID deaths as cases rise. As of August 28th, confirmed cases of COVID-19 from 55 African countries reached 7,695,475, while over 61,945 and 696 vaccinations have been administered across the continent. 61 million, right? 945,000. Yeah, I think I'm reading that right. Reported deaths in Africa reached 193,394 and 6,791,572 people have recovered. Yeah, that's a good recovery rate, but recovered don't mean you've been restored to full health. There was a Black young man who was very healthy, exercise enthusiast, health, eating right and all that. And they interviewed him here in Gaston County in the local paper. And he was saying, like, after he recovered, and he was hospitalized after he recovered, that whenever he took a breath, it felt like his lungs were burning. Is that how you want to live the rest of your life? Yet we had these anti-maskers talking about wearing a mask is going to give you carbon monoxide poisoning. Okay, your body doesn't produce carbon monoxide. Those are automobile vehicles coming out the exhaust pipe. That's carbon monoxide. When you try light charcoal doing a grill, that carbon monoxide gases is coming off of that charcoal. What your body produces is carbon dioxide. So these people are not even using the proper terms. All right. So anyway, it's just junk pseudoscience that they pushing. And again, these could be ignorant Black people, just fearful of certain things, which, they have reason to be. Some of these people are just, I think, white supremacists or the proxies of white supremacists. They want to see a decrease in the Black population worldwide, especially since we've been getting these reports that whites which are already a global minority, but they're projecting to be a minority in the United States. Then we have COVID, which I'm not saying it was started off as a biological attack, but I have talked to some people who suggested here in the United States, it could have been because you had two different epicenters, one in LA, one in New York going on at the same time, and that's not how viruses naturally move, okay? I'm not saying it was a biological attack. Maybe it was a accident, leaked out the lab, or a lab worker got infected, then brought it out. I don't know those things. I don't know. A lot of you don't know either, but you're putting out stuff that's like it's fact. But even if it is, like my friend, the epidemiologist, Angel Fall said, whether it's man-made or produced by nature, or it came from animals, your response to it should be the same, protecting yourself. So anyway, all Africa is reporting an increase in deaths. All right. So, here in the United States, we like to engage in spookisms and what have you. You can't trust the white media. You can't trust the corporate media. This is worldwide. This is what part of global pandemic do these people not get? That's what I don't understand. Let me see. I think it was one more that I shared. No, that's it. I'll leave it there. Y'all can go to allafrica.com. I subscribe to their email to get all these reports. So I don't want anybody using any spookisms and talking about, oh, he using the information from the white man. He pushing the white man propaganda. Again, all these non-white nations are participating in this conspiracy. I don't think so, man. That's not even logical. It's not even logical. So I'm going to continue to present information, not kind of trying to convince you to do either or. But what I am is doing my job, which is to present a news program sharing information that I have vetted, that I believe to be accurate. Okay. That said, y'all protect yourself. You're not going to get vaccinated. At least follow the protocols on masking and social distancing, because black people are dying, and we got all these fools out here lying, and the stakes are just simply too high. Peace and blessings to all. This has been Scotty Reed with a Black Talk Radio News commentary, asking you to support my work by supporting the work of the nonprofit media organization, Black Talk Media Project. See the links in the description on ways to participate in funding independent Black media projects.